Hello and welcome to Season 3 of the Becoming Women podcast with me, your host, Ella Sims. My mission with this podcast is to support teenage girls as they navigate the ups and downs of growing up. In the next 8 episodes, I'll be speaking with an inspiring female guest and asking them what they learnt during their teenage years. This season, I'll be bringing you female specialists in activism, business owners, psychotherapy, mental health and well-being. By speaking with both professionals and inspiring independent women, each individual episode provides you with confidence, tools to handle any challenges you may face, and the reassurance that you are not alone and those tricky teenage years will pass. In this first episode of the season, I am with Dr Melissa Snaith. Melissa is a Chartered BABCP accredited clinical psychologist. She is trained in a number of psychological therapies including Cognitive Behavioural Therapy, CBT, Schema therapy and eye movement Desensitisation and Reprocessing. She has a specialist qualification and experience in the treatment of post-traumatic stress disorder and complex PTSD difficulties. She has worked in the NHS both on the front line and commissioning services and is passionate about improving the quality of psychological therapy. As the CBT lead for Healios, she works with her team to innovate and develop psychological therapy for a high-quality service. As well as running a private practice, Melissa lectures and supervises in evidence-based psychological treatments at the University of Reading. Hi Melissa, thank you for joining me today.
Hello, you're welcome. Good to be here. Thanks for inviting me.
You're welcome. And just to give an introduction following the bio that I've read out, you're a clinical psychologist as your practice and what you do every day. Can you tell me what led you down to take that up as a profession?
Gosh, yeah, it's funny. I sort of was drawn to it at university, and they're quite difficult courses to get on. So I was on quite a mission at the time to get the experience that I needed. I suppose I've always had quite an interest in how things work, but I've been told, I don't know if this is true, that there are 2 types of psychologists: the ones that care and the ones that understand. So you're driven by either sort of nurturing or wanting to understand. I'm sure it's not that simple in practice, but I'm definitely more of an understand. Hope that doesn't mean I don't care. But my dad's an engineer, and I think I have that sort of brain that wants to make sense of things. And I guess psychology, because it uses something called formulation, which sort of maps out a problem and works out what's kind of keeping it going. I guess it's a little bit different to sort of diagnosing something, and that was probably quite appealing for me.
Wow, that's actually, when you break it down like that, that's actually really interesting and makes sense if you're thinking about engineering and the different components. But you want to do that with someone's mind and their feelings and their behaviour. What kind of experience did you have growing up? Was there anything earlier on that made you think in that way at all?
Yeah, I mean, inevitably, I think our experiences growing up form who we are. And I think I had quite a difficult time communicating with my mum, particularly through my teens. We're quite different in terms of how we sort of understand the world, and I think the conflict there probably made me more curious about communication and wanting to understand people. As a child, apparently I always asked why all the time, so I just had some innate sort of tendency to want to work things out. I think I was really lucky growing up, really. I had a lot to be thankful for and a lot of really good influences. My grandmother was an amazing woman. She was very warm and very great at encouraging and praising. So that was lovely to have. And, you know, I suppose as a psychologist, I've realized more and more where we have those positive relationships, how important they are and how lucky we are if we've got them, to make use of those. But certainly I had some challenges as well. I found I changed primary school when I was about 6 or 7, and it was really distressing. I didn't want to go, and I was really scared, and I'd run away every morning and sort of cling to my dad and not want to be left there. I'd gone from a small school to quite sort of big classes, and it was all very strange. And I found that sort of sense of it being the outsider and everything being strange was really difficult. And I don't know that directly affected me wanting to become a psychologist, but it's funny how early memories can be so strong, even as an adult. You remember certain things from your childhood that sort of stay with you as quite powerful. And I guess on the upside, though, I had sort of quite red hair when I was young, and at that school, a group of boys tried to bully me, and so I attacked them. They didn't do it again. So I obviously had a bit of a feisty side as well as the anxious part. But that was that school experience, trying to transition across. That was quite hard.
Yeah, it is really difficult when you have a change like that, or you move to a new school, or you go from primary to secondary, and you've been in a really small, close-knit environment, and then your classroom size doubles or triples, and you feel quite lost, and the schoolwork as well becomes more intense.
Yeah.
Do you have people working with Healios? It would be nice to talk about that a little bit, and what you do there.
Well, Healios delivers a kind of digital mental health service. So we're all about well-being and emotional well-being for young people. We've recently also started working with some adult groups as well. And there are a number of services that we provide. So some things like neurodevelopmental. So we'd be working with things like autism or ADHD, perinatal, which is all about around the childbirth experience. But I'm the clinical lead for the Cognitive Behavioural Therapy service. So sort of CBT is the sort of short acronym. My role is all about the quality of what we deliver. So we want to be sure, obviously, that the therapy that we're delivering is top quality. And a lot of our work comes in partnership with the NHS. So child and adolescent mental health services in the NHS have often bought Healios in to do specific service work with young people. And we would offer usually around 10 sessions of CBT initially, which may be extended depending on the circumstances, probably weekly. And it's face-to-face, like you and I are talking, but it's from the comfort of your own home, which gives a lot of flexibility. And it also means it's easy for the family to sit in, if family or friends can join sessions if somebody wants that. You don't have to. And the quality of the care would be the same as if you're actually just going physically to a place and seeing someone in person. So we're delivering it, but just in a more accessible format.
And if someone's wanting to get in touch, are they better to go through their GP and there may be a referral to you, or can they also come to Healios directly? Because I know it's a digital platform, so they get in touch that way.
Yeah, the GP is a good route because we have contracts with a lot of NHS services across the country now. So it's quite possible that we have an NHS contract in your area. And essentially you get a login and you can view all your sessions online, and you get the same therapist as you would normally, and you just work through a program that would suit your particular difficulties. So, for example, you might have problems with low mood, and so you'd be coming along and having specific sessions to help you look at ways that you could shift your low mood, either through changing your thinking or changing kind of activities that you're doing. Or you might have a problem maybe with social anxiety and concerns with, friendship groups or school or performance, particularly things like, having to speak in class or worries about that. So we treat the full range really of different problems that people come with.
And so can you see the progress that you're making? So if I guess at the beginning you may say, okay, my mood is really low, is that tracked online as well if you're having that one-to-one conversation?
Yeah, absolutely. We have basically questionnaire type measures that we do at the beginning of every session so that you can see, because obviously progress isn't always, linear. It's not better each week. Sometimes you have dips, you have ups and downs, and those questionnaires can be really useful actually for highlighting what's made somebody feel better or what's made somebody feel worse. So we have those, and we have satisfaction measures as well to make sure that people are giving us feedback on how they're finding their therapy.
And how does it work if you said your family can join if they want? So are they all huddled in a room together?
Yeah.
Or do they all log on in different locations? Or maybe it depends on the person.
Yeah, it does depend. There are different logons, so each family member that you want to be involved can have a different logon. So they might come up in a different window, or they might literally be seated together and working through the same computer. So we have got options there, which is good. And it is useful. Some young people don't obviously want their parents to be in their sessions, and that's absolutely fine. Or they might want them to come in for a particular session. Maybe there's been an issue that's been identified and the therapist suggests that, or the young person suggests that, and working together to kind of solve system problem, and improve communication, that can be really valuable.
Oh, amazing. And if, say, a young person, I know you also work with children and adults as well, so depending on their age range, if they've gone through their series of 10 sessions and things have improved, but they relapse or they feel like similar patterns or feelings are coming up again, can they come back to that same therapist and work with them?
Yeah, well, we have options for that. It's on an individual case-by-case basis. So first of all, with CBT, we'd always be wanting to give people a set of skills and tools that they can take away to sort of become their own therapist. Ideally, we want to empower someone to do that. And we'd always have a relapse plan. So you're always thinking at the end of therapy, you think about the kind of difficulties that might come up and how you might handle those, or particular things that might wobble you. So that's planned for deliberately. In terms of coming back, if the contract with the NHS is still open, then there's always the possibility of coming back and having some sort of top-up sessions. So we'd look at that based on the area that you're living in, and whether you would then be able to come back and access it. But yes, it's certainly an option. And the other thing that's an option is that we have other services. So where the NHS has basically purchased in a range of services from us, it's quite useful because then we can be flexible. So sometimes we might be working with a child using the CBT, but then identify perhaps that there's more of a neurodevelopmental problem, like perhaps an ADHD problem or something like that, and then we can refer them across to our neurodevelopmental service.
That's great. So you can interconnect with other clinicians that you've got
with different specialisms.
Yeah. Have you been through therapy yourself?
Yeah, I have. Yeah, I've had different sorts of therapy at different times. I think it's really important to. Well, I guess there's a few reasons why. I think it's really important to know what it's like to experience the other side of therapy, and people are. We're not robots, any of us, and sometimes there's a pressure, I think, to feel that as a psychologist you've got it all together and you never struggle with anything, and that's just a complete illusion. And it's important to be able to say human beings are all human, and we all have times in our life when we need to make sense of things. And I think I'm glad, really, because it feels like things are evolving now, so that therapy is seen as a self-development tool that most people could benefit from therapy in one way or another. I suppose we all have things we want to improve on, whether it's our relationships or how effective we are at work or our general well-being. And we're really good at sort of thinking about our diet and thinking about, exercise and maintaining our bodies. But somehow the mind can get sort of forgotten, like it just has to kind of cope. So, yeah, I think at different times in your life, it can be really useful.
Yeah, it's interesting that you say that we may not necessarily think initially to take care of our mind and, your brain and your emotions and your thoughts and your feelings, and that it's an area that perhaps people just don't feel comfortable to go to. And I definitely think that maybe 20 or 30 years ago, if you said you were having counselling or you're working with a therapist, it's just a bit of a taboo and you'd keep it hush hush.
Yeah.
Now things are changing a lot, which is great. People are feeling that they can be more open, or say I'm going to some CBT sessions because I've got anxiety and I want to be able to work on that.
Yeah, it's a fantastic change, because it's just about sort of honesty and openness, and the more people can be human about things, the easier it is to kind of just adapt and cope. I mean, everyone has big challenges in their lives, transitions or losses, and it's funny, there's that sort of, I think historically, that culture of stiff upper lip, isn't there, and the sort of somehow it's weak to admit that I have emotions. And I see, because I specialize in post-traumatic stress disorder privately, so I've seen a lot of people who including sort of soldiers, who are really tough, strong, very together, police, paramedics, firemen, people who are very resilient, but sometimes some experiences, it doesn't have to be a big T trauma, sometimes it can be what we might call a small T trauma, like a relationship breakup, very powerful. So I think those, that's a bit of an out of date view that hopefully is now evolving, and people are realizing that there's a lot of growth opportunity. People can really learn, and actually needing support is kind of human and normal rather than a pathology. I guess possibly the history of how psychology sort of has developed from a medical model might have influenced that, and it's perhaps helpful that now people, I think there's a whole movement thinking about, it's not about what's wrong with me, but what's happened to me.
Yeah.
And that's it's not a permanent state, it's fluid, and people evolve and can move through difficult experiences with a bit of help.
Is there a common issue that you find young girls in particular experience or go through, or there's a particular pattern around certain ages, just from your experience, whether working in CBT or with post-traumatic stress as well?
Definitely. I think for all people, acceptance is massively important. We all need social reinforcement and kind of friendships and things. But in the teenage years, particularly, that whole thing around social comparison and the need for acceptance is particularly strong.
Yeah, with your peers, yeah.
Yeah, it's a tough one. And of course, it's always been the case that's it's almost a life stage thing. You're moving from being very much a child in a family to sort of out into adulthood in the world, and as a result, your friendships often become more important as a path to adulthood. And so it's so important to find common ground and a sense of belonging. And I think there's quite a high level of social anxiety in sort of teenage age group. And I'm wondering about the way that social comparison is so visibly everywhere now. Sort of it was all around, it almost culturally it's become much more visible than it ever has been in, I guess, our history.
Yes, yeah.
I worked at a corner shop as a teenager, and I remember this weird transition. There used to be a couple of magazines on the shelf, you know, Bunty and Jackie, very innocent magazines. And then it felt like overnight there was this explosion, you know, of all these new magazines full of sort of exciting things about, you know, hair and makeup and body image. And I think now there's become quite an over-evaluation on relatively superficial things, like how you look and, you know, how you dress, and lots of social comparison, and that's causing a lot of stress for young girls and young boys.
Yeah, I think you mentioning the magazines, if I think back to growing up, there were probably ones like Ms. that I had when I was probably the younger age range, and then all of a sudden you become aware of what else is available, and you start reading them, or just flicking through the pages. I was having a conversation actually with another psychotherapist last week who specialises in body image, and we got talking about the pace of, if you're going through a magazine, you don't go through it as quickly, and I guess you decide whether you want to turn the page or go back to something, and the intake of information is probably a lot slower. Whereas if you're looking on social media and you're just swiping through, it's a lot quicker. So the images you're seeing and that your brain is then processing, the intake is far greater. And I think that's the huge difference now, is the exposure is global, and the restrictions, they aren't there. So I can definitely see and appreciate that is what's going to cause a lot of anxiety for young girls, and even people the same age as we are, when you see things and you make internal comparisons to something.
Yeah, absolutely. Yeah. It's funny. I think you're absolutely right about what you say about exposure. There's a lot out there, and what we pay attention to kind of grows in importance in our minds. And it's hard to not pay attention, really, because, you know, those sort of visual, as you say, those visual images are everywhere you go and popping up in various ads or whatever when you're online. It's quite a challenge, I think. I suppose I luckily, thinking back, one of the things that's quite protective is if you have other things that you value in your life. So, you know, the more things become really important, and the more you kind of narrow down into a sort of, you know, how I look or being this way or looking this way is important, and kind of more inflexible that is, the more likely it is to cause a problem. So if we think about your values, our cultural value, you could argue, has become too focused in that area. So one of the things that was protective for me growing up was I was really into other things. I mean, I accidentally dyed my hair purple, which I thought looked really cool. And it did look really cool, but then it washed out to bright orange, and I had to live with that as a sort of 14-year-old for like 2 years, and that was really distressing. It was awful. You know, but luckily the school I was in helped, because it was quite an academic kind of girls' school, and everyone was more interested in grades than hair colour. You know, if I had been in a different school, that could have been a much worse experience. So that's about being aware that the context that you're in can make something more or less important, because again, there's social acceptance that's needed. So I think it's quite protective to find groups that value you for things that you value in yourself.
I'm nodding to that.
Yeah, I can see you're looking thoughtful.
You can see that. I think that's a really powerful thing to take some time to think about. And I think when you're younger, especially, you may not necessarily have that awareness at the time. I think as I'm older now, I can definitely appreciate that a lot more.
Yeah, so I suppose connecting with others around other things that give you a broader kind of positive experience of yourself.
Yeah.
So it's going to vary, obviously, depending on who you are and what your interests are. And for me, I was really into horses. I was lucky because we had some friends that lived off the land, sort of on the edge of the grid, as it were. And so it was possible for me to have a horse on their land. And my kind of my self-esteem, if you like, or what I enjoyed came from doing that. And that made it quite protective. So I had a sense of self-identity, you know, this is me and this is what I do, beyond, you know, the fact that I had orange hair. And I think if you can find things that you enjoy, like playing a sport or online gaming or baking or art or something that you can really go, yeah, this is me, or playing an instrument, you know, so that looks and attractiveness basically become less important, because we'll lose that anyway as we get older. You may as well invest in more less superficial things that will last and make your life rich and enjoyable.
Yeah, so it's holding on or being aware of that thing that really resonates with you or you enjoy doing, and that can also help with external things that may be going on, if it's exams or you have got a bit of peer pressure, or you know, like you were saying, you change schools.
Yeah,
sorts of experiences.
Yeah, because we can't help it. We're social creatures and we need connection with others who are somehow similar. Shared experiences are so important. And sometimes, you know, that will be, you know, I'm really into fashion and how I look, and, you know, and that's my thing. But for a lot of people, it's important to find connection around, you know, I don't know, reading books, or, like I say, particular online, or you might have a particular interest that's perhaps less mainstream, like sci-fi, I don't know. Mm-hmm. And you can end up feeling that you're the only one and a bit weird. And actually that's not the case. There'll be a load of other people out there who can go, yeah, I really like that as well. That's brilliant. I'm really into it. And we need that reinforcement, you know, that shared sense of somebody gets it. Oh, wow, there are other people out there that get this and get me. It's really important.
Absolutely. I really agree with that. I wanted to ask you, just in case there are any listeners who may be experiencing some certain things, some questions, if that's okay. Panic attack may not feel like a big problem or issue to deal with, but if someone who's not experienced it before having one, or they may not realize that they're having one, because they can really vary on the scale, what could a young girl do if during the event or after it?
Panic attacks are so horrible to experience. They're very overwhelming, very physical, usually, and nasty. Panic attacks are different to panic disorder, so the cause depends, but essentially your whole threat system has gone into overdrive. So what you want to do is to do things that will calm it down. So pay attention to sort of sensory information. So that's things you can see or feel or hear outside of yourself. That can be really helpful. So often if you're panicking, you start to feel very out of control with your breathing, or you might start to feel dizzy and hot, and then your attention starts to go into your body and intensifies all of that. So taking your attention outside onto, okay, what can I see around me? What can I can feel my feet on the floor. I can feel the table under my hands. I've got the cool air on my skin. I can hear a car outside. I can see that it's a red car, and it starts to take your attention out of whatever is so threatening into fairly simple and neutral kind of things you can focus on. Remembering to do that is the trick. while you're panicking, you almost need somebody to remind you to do that. If somebody's there that you trust, then make eye contact with them and watch your breath. So trying to focus a bit more on the out breath than the in breath, because often people can get quite gaspy and not panicking. So breathing out. And trying to think very simple, calming thoughts, like you might say to a 2-year-old, like, I'm safe. This will pass. It's just anxiety. I'm safe. Just to get the message to go into your threat system that this isn't dangerous. It feels dangerous. It's not dangerous. I'm safe. It's okay. So in the moment, those are the sorts of things that could bring the panic attack down from like a 8 out of 10 to a bit more of a 5 out of 10. And then I suppose afterwards, it's about understanding what triggered it, what set your threat system into overdrive. So that would be a very individual, and sometimes it can be sort of almost unconscious in the back of our mind. We haven't realised. So I'd see that quite a lot in PTSD. Somebody might not consciously, it might be that they've seen something on the news and that's triggered a massive reaction. Or it might be something much more subtle than that. It could be, somebody walked past them that looked like their attacker. Someone, if they had been attacked, say, and they had PTSD to an attack, and they hadn't really realised, they hadn't noticed that. But that was enough for their alarm system to kick in, and suddenly they're panicking. So I think it's important to have a sense of, okay, sort of what kicks off my panic attacks, what goes on at the time. What caused me to be so threatened.
Yeah, have you ever experienced a panic attack yourself?
Yeah, I have. I had quite a sort of bout of them when I was in I suppose I would have been around about A-levels time, sort of 18 or 19. I'd had glandular fever during my A-levels, which was pretty bad timing, and I kept getting ill. And then my mood started dropping and I started to panic. I think it was the shock of having always been quite invincible and then getting really sick and not being able to get better and having all that pressure from a very academic school. And I remember the intensity of those panic attacks. They feel very out of control. And I guess I learned how to understand what was causing the anxiety and then ways to respond to it differently and ways to stop it escalating. And I think it's important to have permission to do that, to learn that, because otherwise you try to just sort of keep going, just push on. And ultimately then that's when people end up really struggling.
Yeah, it's I've just hearing you talk about it and the types of responses that you can have, it was just making me think about one I had once, and they are the very intense in the moment and even afterwards, and overcoming what's happened and how you felt at the time. It's probably worth telling someone when you feel ready to, shortly after, to get that support and to speak to someone, because I think it is one of those things where you might feel embarrassed, or you don't want to come across like something very dramatic has happened. If maybe if you're someone who doesn't like drama too much as well. They often can happen in public places, can't they, as well, which makes it a bit more challenging.
Yeah, because public places are quite, you can end up quite vulnerable if you're not feeling good. In a public place full of strangers, you're very exposed, and there's no obvious safety. We have home as safety. Home is often or a safe base. So being out and about definitely can intensify things. And that's why some people end up not leaving the house.
Yeah,
I think your point about being able to say, oh, hang on, this, I might need some help with this, is really important, because sometimes there's a bit of a critical voice sort of sitting on your shoulder and kind of saying, oh, you should be able to cope with this and just pull yourself together. And obviously that's actually quite threatening. So it's not going to be helping calm you down and help you to deal with a threat that's there already.
Yeah, of course. Yeah, I can see what you mean there. You may sit back and think, oh, well, that was stupid. Why did I do that? And add on negative thoughts when really you need to be quite gentle with yourself.
Yeah, exactly. And having that understanding of, I know why this is happening. This is what I'm scared of. It's okay. I can think about it like this. And I know how to manage it. I know what I need to do differently. And then once you've learned that you can have more control over it, your confidence starts to build, and then you can stretch yourself a little bit to learn that it's something you can manage, and then it'll gradually diminish. Whereas if you try to sort of shove it into a corner and pretend that it's not there, then it's likely to keep popping out, and then you don't know when it's going to happen, and it can grow and become more of a problem. So I think it's important to tell somebody. It doesn't necessarily mean you'll need therapy, but it's important that you get support and you understand what's causing it.
Yeah, of course. I think it's always the best with anything. It's a problem shared is a problem solved.
I remember very clearly I was going caving with a bunch of friends, and my boyfriend at the time. I said, we were in Wales. It was some really dark, tiny, damp hole halfway up a sort of cliff face that you had to wriggle into and head first. And I said, oh, I'm really scared. I was really scared. It was proper panicky. And he just went, yeah, that's why we're doing it. And there was something about it's completely normal to be scared right now. This is really scary.
Yeah.
Somehow just immediately took the heat out of what was happening. It's funny how the mind can work like that sometimes. Doesn't make sense, but it did. But it worked.
And while you're reflecting on memories, there are two questions that I ask all guests at the end, and I wanted to ask you, and it's a good place to do this. Looking back, what would you advise yourself?
My younger self, I'd say trust your judgment. Take risks, because it's okay to make mistakes, and I think that would be quite a freeing message for me when I was younger, and now probably.
And if you could give a gift to teenage girls all over the world, anything, what would that be?
I would give them an enormous serving of individuality, and say, just do your own thing. Be confident to just do your own thing and be what you want to be, like what you want to like. And maybe a bit of a sprinkling of adventurousness as well. Say, get out and try stuff, you can do it, and just, even if you think it's a bit weird or a bit unusual, just give it a go. Take some risks.
Yeah, I think that's definitely going back to what you were saying about if you have something that you're interested in, you think, oh, is that a bit quirky or a bit different, or I'm the only one? To embrace that.
Yeah, and can I do this? Well, yeah, probably. Give it a go.
Yeah, definitely. Try it and then see what you think.
Yeah.
Oh, wonderful. Well, thank you so much, Melissa. It's been brilliant. Thank you.
No, you're welcome. Great to talk with you. Thanks for asking me along.
Thank you so much for listening to Becoming Women with me, Ella Sims. I really hope you enjoyed today's episode. Please follow me on Twitter or Instagram, or visit www.becomingwomen.com. I'd love it if you could please share this podcast with anyone you know who would enjoy listening to it. And if you are a young girl, I'd love to hear your feedback on today's episode, so feel free to send me a DM. See you next week.